Welcome back. Creative Brain Week, Day 2, Session 2. Changing populations, changing opportunities. I'm Dominic Campbell, and for this session, really, I'm kind of along for the ride. I just get to sit and add in and do. This is really a session that I'm going to hand over to the amazing Melissa Chan.
Thank you, Dominic. Hi, everyone. A very warm welcome to everyone both in the room and online with us on Zoom. Welcome to the speakers. We can't see you yet, but welcome to the speakers, Sarah Lenslock from Aarp and Pin from Savonics, based in Singapore. My name is Melissa Chan, and I'll be moderating today's session. As a quick introduction, I'm a current Atlantic Fellow with the Global Brain Health Institute, and my work looks into the area of health and social care service design. So today's discussion is going to be a very interesting one for me. Thank you for joining us today as we discuss the topic of changing populations and changing opportunities in the area of aging and brain health. So we have a very exciting session lined up today. We'll be looking into the changing aging demographics and that drive the need for greater innovations in brain health, the distribution and access of interventions in the area of dementia risk reduction and care solutions, and how we can think creatively when trying to reach different populations and help them engage in healthy behaviors. So we have speakers, like I mentioned, joining us from Aarp and Savonics, who will share more about their work and solutions. So to set us up for today's session, the structure will be Aarp will first present their work, then we will move on to Pin's work on Savonics, and then we'll go into a 30-minute fireside chat to learn more about the various solutions and to answer any questions that anyone has. So if you have any questions later on, if you're in the room, feel free to raise your hand. If not, if you're online, just pop your questions over on the chat, and we will have people helping to translate those questions over. Without further ado, I want to introduce our first speaker, Sarah Lenslock. So as we set her up, I'm going to do a quick introduction to you, Sarah. So Sarah Lenslock is the Senior Vice President for Policy and Brain Health in Aarp's Policy, Research and International Affairs. Sarah leads Aarp's policy initiatives on brain health and care for people living with dementia, including serving as the Executive Director of Global Council on Brain Health, an independent collaborative of scientists, doctors, and policy experts. Sarah also coordinates Aarp's role in the Leadership Council of Aging Organizations. Welcome, Sarah. A very good morning to you. Very, very early on your end.
Yes, good morning, Melissa. It's nice to join you.
Yeah, I mean, I'm going to hand the time over to you. I'm really looking forward to your presentation.
Okay, well, we'll get started so we can get to the most important part, which is the discussion in a little. I'm very pleased to be here with you and with Pin, but let's see if I can share my screen so that we can get started. Okay. I'm screen sharing, and let me know if you can see it.
It's working perfectly.
Great. Well, I am particularly excited to be with you all today to talk about changing populations and changing opportunities. The Creative Brain Week is something that I am thrilled that GBHI has started. I'm looking forward to some of the presentations in the rest of the week, and all over the world we're celebrating Brain Health Awareness Week. So it's a wonderful way to kick off and talk about creative brain and aging. I am pleased to talk about business and innovation and technology. I want to give a word about what Aarp is. There may be quite a few of you in Ireland or joining from elsewhere that do not know what Aarp is. We are the largest nonprofit organization in the United States. We have 38 million members, and we, as you can see, well, actually you can't because I've got my screen up. Aarp is dedicated to empowering people to choose how they live or as they age. And we want to help you make your money, health, and happiness last as long as you do. I think that one of the reasons that I am going first this morning is because we wanted to talk about one of society's greatest achievements, and that has been growing global life expectancy. Over the last 100 years, the average global life expectancy has more than doubled. In the United States, it's a 25-year gain. So our longevity is a triumph of public health and medical advances. But along with that triumph has caused some concerns because increasing age is the single greatest non-modifiable risk factor for dementia. And the incidence rate is set to skyrocket as our population ages, rising from about, here in the United States, about 6 million people in the United States currently living with dementia. We expect that to rise to 14 million by 2050. But the good news is we actually have a chance to change that trajectory. But we can only do that by knowing about and sharing the fact that cognitive decline is not an inevitable part of aging. And we have to first share that information and then get people to actually take actions so that they can achieve healthier brains. AARP is very aware that by 2030, 1 in every 5 people in the US will be 65 or older. And we're actually one of the younger demographics in the globe. Many other countries, for example, Japan is well ahead of us in this area where many more people are older as a demographic in Japan, for example. But by 2035, for the first time, the number of adults 65 and older will be greater than the number of children under 18. And by 2050, you see that the numbers are designed or headed upwards. And because AARP is concerned about the well-being of adults 50 and older and their families, we are constantly doing research to look into what are they interested in. And we know that brain health is one of the most salient topics. 87% of our members say that staying sharp is a top concern, and 92% say it was their #1 health issue. And unfortunately, 3/4 of adults 18 and older believe that memory loss is a normal and natural part of aging and do not understand that there is a huge difference between normal cognitive aging and the diseases that cause dementia. So AARP is looking at this issue 3 different ways. We're trying to move towards prevention, improve care, and spark innovations towards a cure. 3 of our biggest priorities are these 3 initiatives, which I will share more about through the rest of my talk. The Global Council on Brain Health is a collaborative from around the world. Staying Sharp is an innovative platform that we have developed for consumer engagement, hopefully designed to reduce risk for cognitive decline based on the evidence of the Global Council. And finally, the Dementia Discovery Fund is something that AARP has invested $60 million in the Dementia Discovery Fund, looking for alternative and innovative ways to a cure beyond the amyloid hypothesis. So we know brain health is important, and it's important to older adults. But unfortunately, many adults are not doing the activities that we know are most important to support brain health. So we found that only 56% of respondents in our nationally representative survey are exercising or eating well. And we found that the greatest barriers were not knowing what benefited the brain, and the people around you are not engaging in healthy behaviors, you're far less likely to as well. So we asked the adults in our surveys what they wanted to know about, what would be helpful, where were the gaps. And as you see, the Global Council has focused on these topics one at a time. Everything from exercise and vascular risk to do brain health supplements actually help? Or what about brain games in our reports on cognitively stimulating activities? And the effort here is to bring the evidence to bear on what are the modifiable lifestyle factors that might reduce risks of cognitive decline and dementia as adults age. Since the Global Council has been formed, both the Lancet and other studies have suggested that as high as 40% of dementia could be potentially prevented through modifiable lifestyle. So 6 years ago, we established the collaborative, and now we have over 200 brain health experts from around the world that have joined us in looking at the evidence base behind what works and what doesn't to improve your brain health as you age. Not only have more than 200 experts from around the world joined us in the efforts, we've brought in nonprofit organizations, universities, liaisons from, and 110 different issue specialists in the topics. And we've been very fortunate to have their collective experience resulting in these different reports, all available for free to anyone around the world at the Global Council on Brain Health's website. In addition to these reports, we know not everybody is going to read 25 or 40-page reports. So we've tried to distill each report into one-page infographics available in English, Spanish, Chinese, Arabic, and French to give adults a snapshot of the key information about what they can do to protect their brain health as they age. One of our more recent reports was our Boosters for Joy, which was a supplement to our COVID report, where we provide over 100 different resources relating to COVID and how you can overcome social isolation during COVID. And it's a vast array of resources, including arts activities, volunteer activities, things that older adults can take advantage of to combat social isolation. But I was primarily asked to speak about our innovations in technology, our data-formed innovation. And so the Global Council provides the support and the evidence base, but Staying Sharp is the digital platform that we're trying to implement these healthy lifestyle behaviors and give actionable recommendations to individuals. And we're aiming to have this tool be the most relied upon brain health tool for people 50 plus. So the brain health assessment is a comprehensive assessment available online of both lifestyle questions combined with a battery of neurocognitive assessments. Visitors are encouraged to take the assessment every 90 days to see their progress, and the information that we serve up to individuals is tailored to what the individuals have said are their sort of weaknesses. You may be a runner, so getting information about exercise, it's probably not all that helpful. Instead, we might give you the recommendations related to diet or social connectedness. So the platform itself of Staying Sharp has had over 2 million activated users engage with our content around 6 pillars of brain health. And we can tell that people who engage more frequently with the content have seen a 34% increase in their reassessment results. And those who are most engaged have the greatest benefit. We've been very fortunate that just in this year alone, we've received 77 different industry accolades for excellence in digital design, marketing, and video content. In 2022, we are working with academic partners to look and investigate the objective information about characterizing this data from our platform. Because the data is so rich of lifestyle and cognitive function, we believe that the association between self-reported lifestyle behaviors and staying sharp will be able to help detect risk for individuals and demonstrate benefits to cognition as we provide them greater information. So our technology interventions designed for bolstering risk reduction include the Global Council, which is available online, the Staying Sharp digital platform, which is our interactive brain health platform. And then for those who may not be interested in either of those, our aarp.org brain health website provides a wealth of information, articles about these topics. And you can see this selected article that I am pulling up is when the Global Council reported on music and brain health. All of that information is available on our website. But I just wanted to also mention that AARP has been very busy in the space of improving care. We're not going to talk about that today so much, but I wanted to give these resources to people who might be interested in them. So thank you very much. I'm going to stop sharing and look forward to Pin's presentation.
Thank you, Sarah, for that insightful presentation into AARP's work. I think along with the audience, I'm really interested in learning more about the Staying Sharp platform and looking forward to discussing a bit more on that later. I now want to introduce our next speaker, Pin Chin Kwok. So Pin, I'll give you a bit of time to set up while I introduce you. Wonderful to see you again. So as CEO at Savonics, Pin leverages more than 20 years of experience in both corporate and startup leadership roles, including the last decade spent in healthcare in Asia. She's passionate about improving health outcomes and has a depth of experience in innovation, corporate transformation, and startup scaling. Prior to joining Savonics, she was Innovation Director at Lumen Lab, MetLife's Innovation Center, where she developed new solutions to improve health outcomes in chronic diseases. And she has executed on new business models incorporating digital health solutions at Medtronic. So welcome, Pin. Wonderful to see you and welcome. I mean, I think it's evening in Singapore right now.
It is. Thank you. Thank you. Very excited to be here. Thanks for having me. And I'm very excited for our panel after this in chatting with both you and Sarah about this topic. So I was asked to just set this up by introducing what Savonics does, so everyone has an idea when we go into the discussion. Unlike AARP, we're a very small company. We are a startup in the private sector. We've been around a few years. Savonics really has been, we see a world without dementia, and we've been working and pushing the sort of the boundaries in digital cognitive health solutions. You know, we work primarily in Japan and Singapore, and we've done some studies in the US as well. So I think it would be interesting for the discussion later, because I think We'll probably bring some Asia experience, and love to learn from Sarah a little later on. So, Savonics, as I mentioned, is a cognitive health platform. Sorry, can you see this? Maybe I'm not seeing my...
And we can't see your screen yet.
No, it's not working. Hold on one second.
Yeah.
Okay, that's my bad. I thought I had shared. There you go.
Yeah.
We can see it now.
That's perfect.
All good.
Yes. All right, great. Thank you. Sorry about that. Okay, so, we're working on the challenge of dementia. I'm not going to repeat some of these numbers. I think most people here on this call are well aware. What we are really scared of is this tripling of this number in barely 30 years. And so our premise is really, we're very glad that many large pharmaceutical companies are working on this huge challenge, and we work with them. But at the same time, we know we can't sit and wait as well for just the promise of a magic pill. And so what we really believe in, which I think what is very similar to what Sarah was saying earlier, is that we believe that if you can have early detection, not just of the disease, but of mild cognitive impairment, that heightened risk state before dementia, there's a lot we can do to change trajectories. Some of you already may know some of these, but the many studies globally that talk about the reversal of MCI, and we've seen up to 57% of cases reversed if you take the right sort of lifestyle interventions, amongst others, as Sarah was alluding to earlier as well. And for the cases who do not get the MCI reversed, we know that these interventions can delay the onset of Alzheimer's as well. And there's been quite a number of studies with financial modeling done around this, with significant cost savings and clearly an improvement in quality of lives if we just delay it by a few years. The science behind this, I think Sarah talked a little bit about this, and so I'm not going to repeat that, but it's just been so exciting in the last 5 years, especially, where there's just been so many studies coming out from countries all over the world. There was the FINGERS trial, and in Singapore, we're doing the Singapore version of the FINGERS trial as well right now, and working with players in China and in Japan as well, and very, very similar multimodal intervention studies. Savonics being the outcomes measurement tools for some of these studies. So just back to Savonics, we really believe in empowerment. We're trying to enable people of various sort of risk states or maybe early disease states to be able to take control of maintaining or improving their cognitive capacity, and ultimately to help play our role in building a big picture of causal data that underpins risk reduction. So our goal really is to try to fill in some of the gaps. So, today there are many digital cognitive assessment companies, and some of them have been around for a couple of decades. They're doing a lot of good work trying to speed up, make more accurate, maybe even try to be more predictive when it comes to working with clinicians on diagnosis. And we're certainly very supportive of that. What we see is really filling gaps, the before and the after. So, Savonics Comp is a product we've released, and that helps guide people based on an assessment and based on the current and future risk by providing some personalized recommendations and trajectories. And, on the other side, we're working as well with a more clinical system to leveraging a really similar platform, but then work with patients who have been diagnosed to figure out, what best to do to improve their cognition. At our core, we had digitized some gold standard pen and paper tests that neuropsychologists use around the world, and we've done that on a Unity platform that's, for those of you who are not familiar, that's been used in big games like Pokemon Go and all of that. The reason for that is we're trying to ensure access. We want a platform that will be accurate and precise and consistent no matter where anyone is, whichever operating system they use. So, but that's not the be-all and end-all for Savonics, because there are many companies who have digitized pen and paper tests. So what we're really looking to do is trying to find people with undiagnosed either disease or MCI or very high risk and directing them to resources. So clearly there'll be some people who are lower risk, and that's great for them. We'll keep them engaged with articles and education. We'll keep them connected to the community. But we're really working with our clients with these two groups, right? Either at the opposite end, those people who have probable MCI or beyond, and trying to funnel them to the clinical system. And there's a group in between, which really will be the majority of folks who are a little bit older, where they have some risk, and we're working with lifestyle partners to provide them different kinds of interventions. So just a few screenshots to make this real for some of you. So ultimately what we do is we look to appeal first, because the people sitting at home worried about this, as Sarah was saying, they're not sure if this is normal and not normal. And I think a lot of people hesitate because at that stage, they don't think about going to the doctor and being observed as they take a test. It's not very exciting. So, we have been doing a lot of work in appealing to the person sitting at home, measuring them with the test that I just mentioned, scoring them, but not just by giving them a current status, but also something a little bit down the road in the future, in the next 3 to 5 years. We provide recommendations based on their risk level, and then this is in development right now. We're trying to map them as they go against risk states and disease states. So some screenshots here around the work we've done out, getting messaging out to the public. Putting together short, again, consumer-friendly, short screens that are highly sensitive to early detection. We've done a lot of work with large clients and been quite successful at getting people to convert from awareness to taking an action, to taking the test, and so on. We've also put out actually what is relatively new in the industry, a composite scoring with modifiable risk factors, right, that Sarah had mentioned. And we're providing partners that are available digitally or offline locally for those at risk to take action. We're also playing back to people on the actions they have taken. So we've also had people retake us and seen some changes in lifestyle. So we play back the actions they've taken in terms of whether or not they're increasing their knowledge by reading, whether or not they've taken any action by drinking a little less, perhaps exercising a little bit more, whether they're playing the brain games that we recommend. And through that, this year, our focus really is on this sort of trajectory mapping that we're working on. And we're a company driven by data insights. We believe, at least out here in Asia, we're one of the larger digital contextualized cognitive health data. We've made it a point to be diverse in the data we've collected, and in both in terms of geography, countries, as well as in age groups. So we have younger people as compared to traditional academic studies. And we found some really, really interesting things, right? Like, so when we looked at people who are just age 50 plus, who have MCI level impairment, we found out that 92% have not had a diagnosis, have not seen a doctor about this. We have found really powerful correlations with very specific modifiable risk factors. For those who don't have MCI today, we found that, there's about 16% with high likelihood of getting it within 5 years. And we've also seen that standalone cognitive testing misses the majority of these cases. At the same time, we've been used in studies, as I mentioned earlier, that measure, for us to measure outcomes in intervention. So we're putting this whole picture together to try to enable industry to come up with better solutions. So ultimately, as a company, Savonics, is really working on trying to capture real-world data at scale. There are other players who are really key. They are the ones who need to work on either a cure for when someone gets it, or gets more precise around what could prevent it. And there are many parties working on digitalization. There are many parties working just on the AI. Savonics is focused a lot in the middle, which is how do we really get this in the hands of sizable populations at risk, so you get the data that you'd like to see. We work as a private sector company. We work with two sets of stakeholders or clients. They're either farmers and what I call consumer health companies with therapeutics today in the market or in the pipeline going to the market. We also work with payers, and that really varies by markets. It could be government stakeholders in one country, employers and private sector insurers in other countries. As different as they sound, Savonics works with both of these segments because ultimately, for us, what we've heard from them is they're looking to do a few things in a very similar way. One is, they want to find people earlier stage, whether it's to provide them their product or service or to engage them earlier on. They want people to then take action, whether it is to consume their product or service or others. And everybody wants real world data. So we found it to be really interesting as a private sector company to be able to work with such different pillars. And we see this ultimately as a very beneficial closed loop cycle in terms of sort of making sense of the data. So lastly, we are nowhere as far along as Aarp is in terms of our reach. But as a private sector company, we've gotten through quite a handful of people outside of clinical studies and clinical trials, which is what a lot of digital cognitive assessment companies do. We've run our own digital campaigns in a few markets, really learning what messages work, positive or negative, messages of fear versus not, what kind of images work, trying to get at people. We've also done digital studies with academia. This is one done in the US with Boston University called Assist, where we had thousands of people sign up to do a study using Savonics, but also providing a lot of information on the modifiable risk factors. And I think what's most interesting, about us as a private sector company is we've done a lot of different with corporate partnerships. These are mostly our clients, and we have reached out to different communities, either firstly through on-site channels, whether they be community centers, active aging centers, or events that our clients want to hold. We've created mechanisms to get people from offline to online, from postcards and flyers, to creating landing pages that work for our clients. And in some cases we've been pre-installed on this is in Japan, elderly smartphones, so that anybody who purchases that smartphone would have Savonics at their fingertips. So we've done quite a lot of interesting things in terms of trying to get to sizable populations, and I'll be happy to discuss a bit more of that later. And lastly, this is just us. We believe we're trying to be a new kind of cognition company. We're very science and clinically based. We're clinically valid, but we have chosen to not be just a clinician's tool, but to be out there in the public, talking to people, trying to connect with them so they can take the very first step in assessing themselves and be motivated to go do something about it after that. Thank you. I will turn it back to you, Melissa, for our panel discussion. Let me
Thank you, Pin, for sharing the work of Savonics. Can you hear us?
So I've lost the ability to. I'm losing my icons. Okay.
All good? Can you hear us?
Yes.
Okay. Yeah, no, thanks so much for sharing about the work of Savonics. I mean, I think for both speakers, they're talking about the solutions, getting the solutions in the hands of the end users, and then the bit about providing personalized recommendations. And earlier this morning, we talked about translation and go-to-market, and with both solutions, I think they've been articulating, whether it's Aarp translating into different languages, Savonics looking and testing and experimenting with different ways of reaching out to the end users through postcards, through campaigns. I'm looking forward to this discussion. So if you have questions in the room, please feel free to raise your hand. If you're online, just type your questions in the chat and we'll have someone to help translate your questions over. Yeah? Okay, I see that we already have someone with a hand raised. Do you want to?
And while we're coming down to that, I might dive in as well if you don't. So firstly, I want to thank Sarah and Pinchin, and I'm glad you're staying with us to see how this conversation expands. I also know there's a huge amount of intelligence in this particular room. I particularly want to thank Sarah, who got the kind of short straw on this, because while the new kind of way that we can do these kind of events means that we can reach around the world, there is nothing we can do about time zones. So Sarah has taken one for the team by getting up at a ridiculous early hour, and we hope the cognitive risk of no sleep, which we know is a risk factor, won't have too much impact on you. It was fantastic hearing both of your presentations, hearing you wrestle with the challenges of scale, the opportunities of digitization, and something we talked about earlier, which is how we go from the individual experience to almost the symphony of engagement. Because this is a scale that isn't, it's a scale of change driven by the amazing success of population longevity that isn't going to be fixed in any one way. And so all of these together have become kind of interesting. Would you like to ask your question? We'll see where we go.
Yeah, thank you both for an interesting presentation. I was engaged earlier in the week with a discussion with the Scottish Government about using AI to number crunch at-risk populations and looking at self-diagnostic apps and things like that. We identified a key issue as being the problems of reaching the more deprived people in the community who are perhaps more likely to be overweight, have high blood pressure, be smoking or whatever. We thought the educated middle classes were probably relatively easy to reach, but the folks who live in Methil, in Fife, rather harder. And I'm just wondering whether that's an issue that you face, and if so, how have you overcome it?
Thank you for your question. I mean, I think in our discussions to plan for the session, we definitely talk about how to reach people that are not usually reached. So maybe Sarah, if you want to start by taking this question.
Absolutely, it is one of the most challenging questions that we have. We have been relatively successful only because we are constantly trying to figure out how to reach that audience and how to, or those multiple audiences, frankly, particularly in the United States with African Americans and Hispanic communities who have cognitive decline at higher rates, but oftentimes misdiagnosed or are not as diagnosed sufficiently. We found that particularly engaging with those communities by making sure that representatives from the community who they know and trust are some of the messengers that are included in this, in the offerings, making sure that we go into community physically and not have just a short-term presence, but instead are engaging with the community in meaningful ways over a long period of time, so that we become trusted collaborators rather than a one and done kind of intersection is critically important. But also addressing some of the issues related to healthcare access that are lacking, and trying to approach this from a variety of ways, by involvement in the community, by offering resources and being a trusted partner who's there for a variety of topics, not simply brain health, but other areas, whether it's economic issues or fun. One of the things that we've tried to do is make sure that we're showing up in interesting ways. So, for example, just did a concert in which we put forward a rhythm and blues artist and provide free virtual connectivity to the event, and then put brain health messaging into it and the relationship of music to brain health. So that's several of the ways that we're trying to reach hard to reach communities. hear white noise if you
Yeah,
all.
I can hear you, Sarah. Can you hear me? I can't hear Melissa. Okay.
I can hear Pin, I can hear you, but I can't hear Melissa or Dominic.
Throw in. I'm gonna just. I don't know if they can see that. I'm just gonna wave my hand just so they.
I think he can see you, but
I know, but my background is just. I don't think they understand what we're saying.
you do understand what we're saying?
They.
Oh, yeah, I think that means you can speak. I'm going to go on mute for a little bit.
Okay, but I cannot hear. I cannot hear the moderators at all.
Pin,
Yeah.
if you can address the question of how you're trying to reach hard to reach communities, maybe they can hear you.
Okay, I'm going to I'm going to add a little bit to what Sarah was talking about. So in a very similar way, as a private sector company, we've made it a point to partner with nonprofits, with the government out in communities. We've done this in Singapore, we've done this in China, and we let these nonprofits introduce us, talk about brain health, talk about early testing, and help sort of guide um, their target audience through doing this. So I think in a sense, it's very similar to what Sarah was talking about. What is interesting in I think the two things that come to play when trying to reach perhaps a harder to reach audience, one is that trust that we just talked about. The other piece really is, through our work with our corporate clients, clearly they're targeting a slightly different audience in most cases, not in all cases, but in most cases, because we've done a lot of work with them that teaches us a lot about messaging as well. To ultimately, we believe that human messages are universal. What resonates more with people? What could motivate people, to take action? Sometimes it's not talking about brain health or their health. Sometimes it's talking about having time with their grandchildren and things like that. So I think we've put a lot of the messaging lessons we've learned in a lot of our private sector work, but then put that out there with our nonprofit partners to reach the audience. I am still not hearing anything.
Melissa, if you could put the questions in the chat, we can see that. Oh no, I think we've lost Pin now. And I can hear you.
Okay, I can hear you too. I don't seem to be back in the room while my video isn't. That's an interesting tech issue. I've not encountered this one.
Me either. We have to use our creative brain to figure out how to communicate.
Yes, so you still cannot hear them, right?
No, I can only see their hand gestures.
Right, but I don't know if they're getting our chat messages. That's the thing.
dream we were having in Scotland last week was to target people. Started off being people between 45 and 50, and it became people between 40 and 50, then it became people between 30 and 50. And to look at using as much demographic information as we could gather about those people and use AI to try and see if we could identify people most at risk. And it's a huge project, and I don't think we understand how it's going to work. But that's, it's a dream. And I think you have to look at the populations in total. But in terms of intervention, we keep coming back to the how do we get to the hardest to reach. And I think there are lots of solutions, but no easy one.
No, I want to answer Brian's question and on top of what Dominic had mentioned. Earlier, the company that I had mentioned about Reach 52, what they do is that they go to rural populations, they collect this data. Data collected is only as good as what it is if you don't use that data and, take action on it. So what this company does is that they combine the online data collection with offline community activation, right? Whether it's educating on nutrition, educating on various like healthcare, and even having community workers play certain roles to support others in the community. So I think there are different models, right? It's collecting data. It's one
Part of the process, but it's after you've collected the data, what do you do with it, and how do you design different services or programs to be able to drive that behavior change. I think with Staying Sharp, what Sarah had shared, they are trying to use, they are looking across that continuum, providing personalized results. But when we talk about rural communities, then that method will be a bit different.
Which is a brilliant place, I think, to bring this session to a close in the last minute. We can bring questions in, because I see hands popping up all behind me, which is exactly where we wanted to get to. We can't get to all the questions this morning. But there are breaks between these sessions. There is the online chat, and there is the next session where we start to build and complexify what is an already really complex series of questions. So what I want to do is to wrap this session up, to thank you in the room for starting a conversation that we're going to build on, to thank Sarah Locke from Aarp, to thank Pinchin Kwok from Avonix, to thank Melissa Chan, but also to thank those people who, behind the camera, have been sweating to try and to make us connect across the world. So I'd like a round of applause for them all.
I just wanted to say that we can hear you now as moderators. So when you go to the audience, you can't hear. It sounds like there's a mic issue. So that's when the problem comes. So you might want to mute the audience mics if you want people to be able to hear that.
Sarah, it's the perfect place to end. We're never going to mute an audience. We're going to encourage the conversation. And Sarah, most of all, I want to thank you for doing the hard thing, which was getting up at a time that is just ugly o'clock in the morning. And thank you for bringing all your contributions to this session. We'll move on to the next session. The next session is...
I wanted to say thank you as well. I can hear you too. Sorry if you missed a lot of it, but thank you for having us.
Thank you both for joining us today, and apologies for the tech difficulties.
We move on. Thank you a lot. Bye.